those eyes.
Emery on the music. Nice work, Emery, choosing our music this morning. Going to 15 degrees today. We are talking about these eyes. And Dr. Riaz Ahmed's joining us here today. And I'm just reading the survey here that the Canadian Association of Optometrists showed 89% of baby boomers are concerned with the state of their eyes and the state of their vision. And what with October being Eye Health Month, it's a good reason to have you on here to talk to us a little bit about some of those things. So we're going to go through all the top 5. Can we do that?
Absolutely.
First of all, thanks for being on the show. Good
Thanks.
to have you here.
Yeah, pleasure.
Let's talk about a deterioration of reading vision.
Yeah.
So this is, and you, who's this going to happen to?
Absolutely. One of the most common things with the boomers, especially right around the age of 45, start holding things a little further away. They can't see up close to focus. And it scares a lot of people. A lot of people have had great vision all their life, and then all of a sudden they reach that magical age and everything's out to here, and they come in. And for some of these people, it's their first visit to the eye doctor, and they're scared. You know, what's going on? Am I going blind? Am I, you know, is there some serious eye disease going on? So it's a question we get all the time. And, you know, we do stress to people. It's normal. Happens to absolutely 100% of patients.
100%. Everybody. No matter who you are, you're going to be doing this.
Everybody between the age of 40 and 50 will lose the ability to see up close, and it's just a natural sort of aging change in the lens of the eye. So
really,
yeah.
So don't feel bad. It's just the way it is. But
absolutely.
It's that also I'm getting old feeling that people don't want to feel,
yeah,
isn't it?
Yeah, for sure. And and like I say, it scares people. It is perfectly normal, but it is unrelated to eye disease. So you can have great focusing and have eye disease, or you can have terrible focusing and not have eye disease. So the two are independent of each other.
We're going to talk about eye diseases in a sec, but talk another one that I know, Dad. I remember Dad talking about this, having dry eyes all the time. What about that?
Yeah, and you know, let's face it, we live in Calgary, one of the driest places anywhere to start with. So especially a lot of boomers, they have office jobs, they're on the computer all day, recycled air-conditioned environments, it makes it even worse. Then you couple that with being at a fixed focal length for the whole day. The blink rate goes down. There's studies that show the normal blink rate is 12 to 15 times a minute, and studies out of Waterloo shows that it drops to 3 to 4 times a minute when you're on a computer. So when you're blinking that infrequently, the eyes are going to become more dry. So it is a big problem with the dry, irritated, gritty eyes. So there's lots of things you can do about it, though.
Explain. So as I'm listening to you, I'm going 1, 2, 3. But
you blinked about 2 times.
And you notice these things.
Yeah.
So if I'm at a computer, chances are I'm blinking not nearly enough.
Yeah.
And what do I do is there do drops help?
Definitely lubricant drops help. I mean, once people recognize that they're blinking less, they can make an effort to do that. The other thing is the fixed focal length that we talked about. And so we have a rule, it's called the 20-20-20 rule, which is for every 20 minutes of steady computer work, take a 20-second break, look at something 20 feet away. So it relaxes the focusing system of the eye, gets you, relieves some of the eye strain, gets you back into a normal rhythm, and oftentimes you'll blink better. We get people to keep a little drop, a bottle of lubricant by the computer, so things like that can definitely help. And we talk to people about ergonomics too, where to keep their computer screen and how to avoid glare, and all these sorts of things can definitely help.
Now, if I go to drugstore and I get eye lubricant, it'll say eye lubricant. Now, what about those get the red out kind of drops? I've heard those are bad. Is that true?
Very much, yeah. You want to stay away from the sort of get the red out medication. There's 2 or 3 things wrong with it. I mean, the first thing is it reduces blood flow to the eye because it actually constricts the blood vessels. Your eyes are red for a reason. Your body's trying to heal something and fix something, so it's very counterproductive. Some of these drops can't be used. They increase your risk of glaucoma in certain patients. You want to use sort of preservative-free or transiently preserved drops. So there are certain recommendations we make in the office as well, because there are definitely when you go to the pharmacy, it's overwhelming the number of drops you see. So
there are better, there are worse.
Yeah.
Good to know. Okay, eye disease. You talked about some of the ones that are going to hit me when I'm older.
Yeah.
What are the ones that people are most worried about?
Well, one of the things I've noticed over the last 10 years in practice for sure is that my patients are much more educated, especially the boomers. They've heard of diseases like glaucoma and macular degeneration. They have, they're at the age where family members have it, their parents have it, their sister has it. They want to know what they can do to prevent it. And so we love that, because we're always about preventing eye disease before it's too late to treat. So a lot of patients, macular degeneration is a big one. It's a disease where you lose your central vision, and there are things that you can do to control it. So for instance, it's related to smoking. So smoking will increase your risk by 6 times. Wow. Things like diet, so a high dietary intake of antioxidant vitamins or even supplements supplementing with vitamins can help
Really?
slow this.
What about things like carrots? That make a difference?
Yeah, it goes back to what your mom told you, right? And it is true. Carrots are very high in certain pigments and beta-carotene, and those things have been proven in studies to slow down the progression of these diseases. So your mom was right. Yeah.
Oh, there, another one for Mom. Well, she always tended. What about floaters? Those things you see.
Yeah, I mean, that takes us to another question, and floaters are definitely something that pop up, median age, again, around age 50, 55. The jelly that fills your eyeball starts to actually degenerate with age. So as it degenerates, the collagen fibers that make up that jelly start to float around, and they cast shadows on the retina, and you think there's mosquitoes out there, you're kind of swatting at them.
Yeah.
And so everybody's like, hey, what's going on? Am I, and again, am I going blind? Is this something to be concerned about? So the main thing with this is in 10% of cases, you can actually tear the retina when you have these symptoms, because as the jelly inside your eye shrinks, it can actually tear a piece of retina. So, when you come into the eye doctor, we dilate the pupil, make sure there's no tears in the retina. And again, that's only 10%. So for 90% of patients, again, it's normal and they do settle.
How often should I be going to see an eye doctor?
It's for children and seniors once a year.
Yeah.
For adults every 1 to 2 years, and contact lens wearers will generally get them in once a year. If you're a non-contact lens wearer and your eyes are healthy and we tell you everything's okay, generally once every 2 years. But again, it depends. Everybody's individual. Some people have higher risk and they need to be seen more frequently, but for sure once a year.
Once a year, and that's why you're here. You have a website if people want more information. missioneyecare.ca is the website. Thanks so much for coming in.
Thanks for having me.
We didn't get to all 5, but you can go down and go to the office. He'd be glad to talk to you and come in and see how you're doing. Thanks for being here.
Thanks very much.
You know what? We're going to go for a break, and apparently, or I should say, Jill is cooking up the dude food that we should be eating. Jill.